So thread lift has been gaining a lot of popularity these days, and there's a lot of buzz that centers around thread lift, and that's for a good reason, because you're achieving a lift that previously we could have only done with surgery. So it's basically a thread that is made up of a material called PDO, and these are absorbable filaments, what we call monofilaments, that your body will break down in about 6 months. But the effect lasts longer than this because not only do they actually give you a lift, but they also stimulate your own tissue to produce collagen. And when that collagen is produced, it provides a little bit more of a kind of an adhesive or a lifted type of strength, and it also volumizes. And some people think, oh, the effect of the thread lift is based upon how many threads that we put into the face. But that can't be further from the truth. What is the most important part about thread lift is assessing where the needs of different types of threads are and putting them in strategic places, and how we kind of like orient the different types of threads based upon their needs. The way to break down these threads and the types of threads is into what we call fixed versus floating. So fixed means that these threads are fixed to a certain secure points. And usually it is at the level of the temporal fascia. Temporal fascia means it's at the level that is deep, right on top of the muscle. We actually kind of stabilize the thread, and then we lift the further, what we call distal parts of the face. So that is actually more stronger, and it gives you more of a lift. So where we use the fixed threads is to be able to lift up the heavy tissues around the cheek back and around the jaw region. The other type of threads are what we call floating threads, meaning they're not really fixed to a certain point, but by placing these threads, it kind of makes the skin contract. Because as I said before, one of the things that these threads do is that they actually induce collagen growth. Okay? So it kind of gives you that accordion effect. To kind of like increase that type of strength, these threads can either have small, tiny sort of what we call barbs or little combs that grabs onto the tissue to actually physically lift as well as produce new collagen growth. Then there are other type of threads that's floating as well that has either kind of a stranded twist or they're perfectly just smooth. And they all have different functions. Everybody's different. And so when we work with thread, we truly try to customize patients depending upon what their needs are.